So for question one, this is a client who was brought to the emergency room by the family member. And the family member was explaining to the nurse that the client grabbed their chest and complained of substernal chest pain. So the care team recognizes the need to monitor the client cardiac function closely while interventions are performed. What form of monitoring should the nurse anticipate? This is going to be a hardwired continuous EKG monitoring. What that means is that they're going to hook them up to the monitor. All right, so they may do a 12-lead EKG, which is on a portable machine, but this patient is going to need to be monitored. So the answer is hardwired continuous EKG monitoring. So for number two, so this is a client who has homocysteine levels ordered. So which of the following is important for the nurse to teach the client? All right, so which of the following is important for the nurse to teach a client? So one of the first things you want to know is, what is homocysteine? This is an amino acid. So vitamin B12, B6, and folate break it down to create other chemicals that the body needs. However, if there's a high homocysteine level, this means that the person has some vitamin deficiency. And so without treatment, this elevated level can increase the patient risk for dementia and heart disease and even stroke. So what the nurse should teach the patient is that a diet low in folic acid can cause an elevated homocysteine level. In addition to that, a 12-hour fasting is necessary before the blood is drawn, and genetic factors can elevate the homocysteine level. So the next question, a nurse's care for a client who had an ECG. The nurse notes that lead 1, 2, and 3 differ from one another on the cardiac strip. How should the nurse best describe this phenomenon? So first thing you want to know that lead 1 and lead 2, they're actually called bipolar leads, or they can be called limb leads. What it does, it looks at the heart from different angle. So when you look at something at a different angle, you get a different view. So you're going to see that the EKG strips are going to be looking a little bit different with lead 1, 2, and 3. The next question, a nurse is analyzing a rhythm strip. What component of the ECG corresponds to the resting state of the heart? And that is the T wave. And I want to show you a picture. So let's look at this photograph here. So as we mentioned, this part is the resting part. As it comes off the isometric line, this is a contraction of the atrium. Here you'll find the depolarization of the atrium. Then you have a contraction of the ventricle. Now it's coming down. The T is actually the relaxation of the ventricle. So the T represents the relaxation of the ventricle. All right, so let's look at this next question. The nurse is at the nursing station when she saw the following rhythm strip below. What would be the correct way that she would document this? This is actually ventricular tachycardia. Again, this strip is ventricular tachycardia. Let's look at this next question. An adult client with third-degree block is admitted to the cardiac unit and is placed on continuous cardiac monitoring. What rhythm characteristic will the EKG show? So let's look at this third-degree block. What you will see, so you will see the P here. You see there's a long way before the QRS. Look at this. So what you will see, you're going to see 1, 2, 3, 4 P's, but there's only 3 RS's. So what you'll notice is that there is going to be fewer QRS's complex than P complex. And that's how you identify third-degree block. The nurse is caring for a client. Next question. The nurse is caring for a client who has just had an implant of cardiovert defibrillator placed in. What is the priority area for the nurse to assess? And of course, the nurse needs to monitor the EKG with them, because we need to know what a cardiovert is, an implant cardiovert. Just like how if you have the AED and it will convert the rhythm externally. If someone have dysrhythmia and it is continuous, then what they'll do, they'll put an implant in, something like a pacemaker, but this time it's a cardiovert. And if the person have any kind of dysrhythmia, then the cardiovert will convert the heart rate, or convert the heart dysrhythmia, instead of putting an external one, okay? So that's what it is. And this patient will need monitoring. So let's look at this. The next question. A nurse is caring for a client who's exhibiting cardiac arrhythmia, as listed below. The client does not have any pulse. The nurse should prepare for what intervention? So yes, this looks like a VTAC, but the person doesn't have any pulse. So it's called a pulseless VTAC. Okay, a pulseless VTAC. This person need a defibrillation, because what that is saying is that there's no pulse. Okay, so this person need to be defibrillated. Again, with a pulseless VTAC, you will see that they're having an electrical rhythm on the paper or on the screen, but there is no pulse. So they will need to be defibrillated. So what a defibrillation is, this is a technique used in emergency medicine, and it terminates ventricular fibrillation or pulseless V tachycardia. So it uses an electrical shock to reset the electrical state of the heart so that it can beat in rhythm or in sync. All right, again, what a defib does, or a defibrillator does, it sends electrical impulse to the heart, and it stimulates or reset the heart to beat in rhythm or in sync. So there is two shockable rhythm. Remember this: pulseless ventricular tachycardia and ventricular fibrillation. So next question. So the ECG has been ordered for a new patient. What should the nurse do prior to applying the electrodes to the skin? And that is to make sure that it is dry, all right? Because if it's not, then it will not stick. And if the person have hair chest, you will shave the hair off so that the electrodes can stick. Next question. A group of nurses are participating in orientation on a telemetry floor. What should the staff educator tell them about ST segment? And I'm going to show you this graph. So this is the ST segment right here. This is the S, this is the T. And remember that this is now the relaxation, because this is the ventricle contracting. Once it comes down from that contraction, then it's going into the relaxation. And what I want to tell you too is to remember repolarization, relaxation, all right? Repolarization, relaxation. That means the heart is relaxing, all right? So again, just remember that repolarization means that the heart is relaxing. So first elevation of the isometric line is the P wave, which is a atrium contraction. Then the relaxation, which is a repolarization of the atrium, is lost in that Q section, right? As the ventricle contracts, then you have that high peak R. As it begins to relax, it comes down to the S. So the ST segment is actually early ventricular repolarization. Repolarization, relaxation.